Hi, HIM 5301. My name is Kendra Collier. My reading presentation is over electronic medical records and why their time has come. So let's go ahead and get started with that. Here's an overview. A lot of this article is a mere collection or collaboration of articles from the year 2003 and years prior, which means that most of these were published prior to the Health Information Technology for Economic and Clinical Health, the HITECH Act, which was passed later in 2009. Therefore, upon rereading through this, I decided to compare and contrast the outcomes of EMRs after 2009 to what was being proposed during the time of this publication. However, there were beneficial points within the articles that touch on the foundations of EMRs. Again, here we read that the intent of this piece is to summarize important developments in the field and provide a resource for care organizations seeking to justify the expense of an EMR systems. One of the first articles entitled Electronic Medical Records No Longer Optional. In this section, it goes on to describing how under the Bush administration, there was a promise for 53% increase in funding to promote hospital-based applications of IT to improve medical records. These pushes of getting serious about EMR led to changes in electronic health reporting. More and more physicians are coming from medical school and they know how to use technology towards their advantage. This meaning that those physicians allowed for a better induction of EMRs to be used, because previously a lot of physicians rejected specialized clinical systems mainly due to not wanting to use the technology, which in the beginning it wasn't very user-friendly. So one of the reasons why it's no longer optional, it's more of a need. That's what this is saying, because we have the ease of convenience that physicians and other healthcare providers and organizations and professionals can use it, and it's also a valuable tool with a quickly acquiring necessity status. And again, physicians and executives within these healthcare organizations are viewing information technology more favorably. According to this sub-article, CPRs, computer-based patient records, are what started it all. Beginning in the 1980s, the CPR was often a longitudinal record that captured paper-based information in an image format for later reference. EMRs encompassed CPRs. EMRs capture and manages patient data that originates in electronic form. In the article, it states that EHRs are the future, but as we are speaking in present tense now, once again, this article was written in 2003, so we've come a long ways from there. Once again, also stating that the article states that EHRs are the future, but as we're speaking in the present, again, we are in what is considered the future. We are familiar with what EHR is, and that the generic definition is that it's the patient's medical record over their lifetime. Hopefully, in what is the future to us, the different areas of medical expertise and the different specialties will all be linked. So we'll have your ENT doctors, your urology doctors, all those different records will be in one main system. EHR standardization timeline. I didn't really put down the timeline. I really couldn't read through all that. It was kind of mumbo jumbo. So it was predicted that sometime in the later part of 2004, testing of Medicare Medicaid differential reimbursement scheme, in which healthcare provider organizations using EMR systems will receive more reimbursement for services than those without technologies conforming to the standard. yes, here we are years later. We know how the changes in legislation on the behalf of the changes in Medicare and Medicaid have influenced the change for EMR and EHR systems. And we have found that these newly implemented systems, they also affect clinicians, public health agencies, which is currently the field that I work in, hospitals, payers, researchers, suppliers, pharmacies, and most importantly, patients. So once we do get the EHR standard in the future, well, now we pretty much have it now. Once we get it fully implemented, a national standard for health records will affect the entire health community. Listed here are the basic components made up in 2003, I keep wanting to say 2013, that are pivotal in supporting an EMR system being proposed at the time. Overall, it was said that what an EMR system should do depends on who you are, meaning what you need and how much you need as an organization or company can spend. These also tie into our readings for this week using some of the key components that we've read about. On the left, these are cases of surveys taken to deciding on how planning to invest in an EMR would benefit their organization. Regarding cost, here are some numbers based on the 2003 estimates. However, I failed to check to see what they were actually are in present day values. But here we have 10 million roughly estimated in a large hospital system. Let's just say hospital or system. 10,000 to 20,000 for a physician practice per physician, with operating cost another 25% per year. It was found that using an EMR had assisted some facilities in keeping track that they saved money on medicine because beforehand they were down coding in their workflow. So it was found that in their survey that they had taken, implementing an EHR system would benefit them greatly because they had been down coding, because in case they got audited, they would rather try to make up for, you know, the less amount rather than try to figure out the higher amount. So that helped. We found that the survey found that there was a decrease in medication processing time by 68%, reduction of medication discrepancies by 55%, reduction of problem medication orders by 58%. And again, these numbers were based off the survey done in 2003. And here we have some do's and don'ts of selecting an EMR. These are a few tips for healthcare organizations and facilities looking to implement and make the best of an EMR. Don't think that one product can do everything. Do employ that competitive selection process. Don't set unrealistic expectations. Drive the selection process down to end users. Buy an EMR only after seeing it live, and don't buy futures, meaning that do not invest in what's promised today. However, choosing on what's available. However, I wouldn't fully agree because you would want to allow for technological advancements. So you would kind of take in consideration on what you may need for the future. Make sure that it be applicable, and also make sure that it has room for updates and that it would be compatible areas for compatibility. In conclusion, again, this article was really a collaboration of different summaries, different articles, all into one during 2003 before the HITECH Act was passed. So yes, I state that it is outdated. It was pretty much outdated. This is part of a special section published in the Healthcare Informatics and Healthcare Information and Management System Society Journal. Thanks for watching. Please leave feedback within the designated area in the reading presentation forum. I'd really appreciate it. That'd help me do better for the next reading presentation that we do. And here is my reference. Again, thanks for watching.